Huples cat, you're in for a treat. Back in December of 2018, I read a book and it was really impactful to me. It's called Influenza 1918 and it's about Winnipeg, one of the major cities of the Midwest of Canada, and at the time one of the major cities of Canada for industry, and how it had affected all of the aspects of life in Winnipeg during the pandemic, Spanish flu. And what I'm going to do is I'm going to have that video up, and I'm going to stop the video and I'm going to put in my perspective in May 2020. So grab yourselves a coffee and a vegan snack, settle down and see what I was talking about and what I got wrong and what I got right. Congratulations, if you survived the 30-minute video on this book, you deserve a medal. It is in the description and it's actually worth watching. This is going to be a lot snappier. Basically what I want to talk about is Spanish influenza, the effects on Winnipeg in 1918 and 1919, the unobvious. So the actual spread of influenza was slow at the beginning. In the pre-aeroplane age, what we saw was a slow spread of the influenza across continents, and you could actually see it hitting Halifax and then Montreal, Toronto, and then Winnipeg. So you actually had a week or 2 or 3 weeks notice that it was on its way. Of course, in 2020, it just hit places quite at random quite quickly, and other places got bypassed. Look, right from the beginning, the number of nurses available to provide care was inadequate. That was certainly true in 2020, today, because Ontario actually has much less nurses per 100,000 of the population than anywhere else in North America, I believe. And we have much less ventilators, much less ICU beds, and a lot of other places. And that's one of the things. There is no capacity in the system to have the system suddenly become hugely bigger, and you provide especially nursing care, respiratory therapy and anesthesiology, critical care medicine and ventilators. It's not that easy as just churning out a straight box ventilator and just hooking up people to it and walking away. You actually have to do a whole bunch of stuff to stop them from dying with the ventilatory care. So coupled with inadequate numbers of nurses at the beginning, the nature of the work and the fact it's an airborne influenza, the staggering effect right at the beginning of this influenza outbreak was that it's estimated more than 1/3 of all trained nurses in Winnipeg got flu and couldn't work, or at the beginning. We have a fairly significant number of nurses who are off because they have immunocompromised disorders. We also have had a few numbers of nurses actually get symptoms and go off. We've also had nurses become positive and go off with symptoms or without symptoms. So again, you've started with a smaller number of nurses than you actually effectively need to provide reasonable care all the time, and now suddenly you've got a big spike in cases and you haven't got enough nurses to deal with it at all, and those nurses are actually dropping and getting infected. 20% of the nursing students also came down with flu. We don't have any nursing students working, they've all been sent home. I think it's sensible. I think it's a good reserve of people to actually work if it gets really bad. But also the truth of it is, and the sad truth is, a lot of those nursing students in their 4th year were very close to graduating, and I think we could have accommodated them reasonably safely in their final placements and actually had them trained and ready to work. To actually put all of the nursing students out on the street, literally, was a bad idea, but that's what they did. Now, not surprisingly, those people who nursed children actually came down with it much more frequently. 2/3 of the pediatric nurses came down with flu. Children are pretty bad at containing colds and coughs. Of course, they still are, but the percentage of children affected by this is a lot smaller than it was in Spanish flu in 1918. The number of young adults is a lot less than it was in 1918, where it principally hit the 20 to 40 year age group. What we're seeing is it's principally hitting here the 40 to 60 year age group, but it's particularly lethal for the above 50-year-old age group, and especially for men. Each flu virus acts differently, which is why having a set idea of how you're going to tackle it and what you're going to do about it right at the beginning of the pandemic is never a really good idea, other than in very, very general terms. You have to be flexible. So as soon as they recovered from the flu, and oftentimes they were in bed for a week or 3 weeks with this, as soon as they recovered, they were put right back into work. In 2020, we're putting staff back to work 48 hours after they've had no symptoms. And not surprisingly, with one death after another, and in the predominant age group of 20 to 39. This had a harrowing effect. In 2020, we're asking for recently retired nurses and doctors and RTs and paramedics to come back to work. Certain parts of England and America have asked for retired policemen to come back as well. It's interesting, we're repeating again and again what happened in 1918, but I don't know if a lot of people in government are actually that familiar with the history of Spanish flu, and they probably should be. Nurses also died in Winnipeg. They reckon about 7 of them died. But again, we're dealing with a much smaller population than in 2018. Now it quickly escalated. They started to ask for retired nurses, nurses who had married and quit nursing, because at that time you couldn't be a married nurse. Bear in mind, nurses then largely were female, except in psychiatric hospitals. And they asked for people with St. John's first aid courses to come forward. Quickly, it became apparent that the nursing shortage was a critical function. And then they gave up on that, and they asked for anybody to come forward to volunteer to nurse, and they would give them 4 days training to do so. And in 2020, depending on how it goes, I could actually see that happening again. Again, this was predominantly females that they saw. So with the schools closed, but they were paying the teachers, who again are mostly female, they actually got a large number of the teachers to actually become nurses, and a lot of those nurses were community nurses that went into people's homes, providing basic nursing care. But one of the things that's not really known about the Spanish influenza outbreak is that a minority of the patients suffered severe delirium and confusion, and often became unpredictably violent. This is something I don't think people are taking on board for their pandemic plans. Are you able to restrain the strongest member of your household in bed if he or she becomes violent? You do need to think about stuff like that, which will be covered in the pandemic series, I promise. I didn't really cover it that well in the pandemic series in 2019, and luckily, thankfully, strangely, SARS-CoV-2 virus, when it causes COVID-19 disease, makes happy or silent hypoxia. We're not getting the violence, we're not getting the confusion. People are absolutely seem to be completely fine, and they have oxygen saturations that are abysmally low. And more on that when I get my peripheral oximeter, because I've decided that I need one. Not surprisingly, the fabric of society was collapsing, and not surprisingly, the people in power were mostly men. And not surprisingly, their focus throughout the whole epidemic was to get business and the economy functioning again. We saw exactly the same thing in SARS. So the access to hospitals was reduced because people didn't trust hospitals, or they didn't want to afford hospitals, or they didn't see hospitals as being there to serve their needs. That's changed in 2018. But I think it's interesting to know the figures. As I've said before, they did not actually ever fill up their beds. They had about 500 beds that eventually set up for influenza cases, and they probably got about 300 of those occupied at any one time. However, on any given day during the peak, they needed an estimated 6,000 beds. Well, it hasn't changed in 2020. The economy is still by far the more important focus for an awful lot of people, not life and death, and that's probably wrong. And I was wrong. In 2018 I said that people will still seek hospital care. That's not true at all. We've seen a massive number of people not coming to emergency departments for conditions they normally would come to. People again are starting to see hospitals as a danger zone, probably rightly. Other than the social aspect that people did not trust hospitals back in 1918, the other fact was that all of these voluntary nurses that were floating around and bringing free food and giving hospital care in people's homes also convinced people they didn't need to go to hospital. One of the things I would have liked to have seen set up by now in May 2020 is a comprehensive volunteer with some professional core group leadership, community nursing. We haven't done that. We're sitting ducks for this. If we get a second wave that mutates, that kills or injures a lot more people than the first wave is doing, we have a lot of people stuck at home without any basic nursing care, and we should have set this up in advance. And I'll say that again, it should have been set up in advance. So again, in your local community, set up something like that so you can respond in your local area. If you have a lot of people sick at the same time and requiring people to go in their homes and help them out, it's not enough just to wait for this stuff to be required and then try and set it up. It doesn't really work. Once they were so sick they really should be in hospital, by then it was often too late to transport them or do anything realistically to help. As with SARS in Toronto in 2003, families were barred from visiting. This happened at Toronto General. Very early on we had a family come in who we did a screening on, who said that they hadn't been exposed to the patient when in fact they had lied to us, and we had to send an entire shift home and quarantine for 7 days. So right from that moment, Toronto General stopped all visiting. Sunnybrook did not. Sunnybrook allowed people to visit the critically ill, which are the last people that should be being visited by visitors in a pandemic. Much the same story in 2020. Actually a lot tougher. We've restricted and stopped almost all visiting at my hospital, and all of the hospitals in the area really is very hard to get in to visit. My hospital is still allowing some visitation for certain people just prior to death, and we're also allowing some visitation for pregnant women as they give birth. Other hospitals aren't, and I think that's one of the horrible things of this, is that if my father-in-law or mum-in-law goes to hospital, and my father-in-law did have to go to hospital, and thankfully he's fine now, is we can't be with them, and that's really a shame. More so for their psychological need, but also for our psychological needs. It's really tough to have somebody you know and love very well be sent to hospital. You don't hear or really see much from them for a few days, then you hear they're dead on the phone. Bad. You can't even go in and see them. One of the issues you might find you're dealing with is actually lack of nurses because they're all sick or staying at home, and also the doctors. The interns in Winnipeg, the trainee doctors, they actually decided to take advantage of this. Now, one of them got infected, so what happened was 3 of the 14 interns actually stopped working immediately, and 2 of them also then later on resigned. So even without the effects of the flu, Winnipeg lost 5 of its 14 doctors that would work at that time. And during SARS we had many doctors who refused to come into the hospital, or if they did, refused to leave their own offices. This time around, largely I'm not seeing that. I'm seeing most people who are trained and working actually showing up most shifts, though we are getting a substantial number of people going home during shifts or not showing up. But the effect is much less than what I'm seeing than during SARS. Pretty much people are attending and are trying to do their job, but they are very scared. Obviously there's a lot more people getting sick and a lot more people dying in terms of our profession here right now than there was in SARS in 2003. But one of the things I'm thinking is a long-term sequela of this pandemic is how many people are in medical and nursing and respiratory therapy and pharmacy training right now who have quit, who aren't going to actually continue their studies or go back to them for various reasons. So I think we're going to face an even greater shortfall in staff over the next 3 to 4 years than we otherwise would have done if this pandemic hadn't occurred. So when people were transported to the hospital, they were in advanced cases of septicemia and respiratory distress. And mostly, not surprisingly, they died within 5 minutes to 8 hours of admission to the hospital. Hospital basically was somewhere you put somebody just before they died. And I think we may well see that happening again in a massive pandemic. So in 2020 we're seeing that as well. A lot of the cases who are coming in are quite sick when they arrive. The big difference with this type of a virus compared to one in 1918 is the fact that most people aren't going to die from the virus even when they go to the hospital. But the people who are in the hospital who require advanced life support and ventilators and CPAP machines and a lot of other stuff, a lot of them will die. About 70% of them will die. And the length of time in the advanced life support phase is about 11 days to 14 days, and that's a significant burden on the hospitals. Of course, back in 1918 there was no such things as mechanical ventilation or assisting devices, so people who needed them died, and that's what contributed to the death rate. So we're able to save about 30% of the patients who otherwise would have definitely died from this in 2020. We can do that whilst healthcare remains intact, which is why you hear an awful lot about flattening the curve to stop the hospitals getting overwhelmed. Funerals. They ran out of coffins. Funeral directors started to crank the prices up. The average decent funeral was $135 to $165 at that time in Winnipeg. The prices hit over $900 for a funeral, and that's something you might want to take on board. If funeral service is still available, you're going to have to pay for them. Funerals in the modern age are incredibly expensive. If 2 or 3 of your family are dead and you have to pay for the funeral costs, you might be struggling financially. Not a pleasant thought, but we are preppers, so we look at the unpleasant as well as the pleasant. I've not heard any reports of price gouging by funeral directors, quite the opposite. I think that's a good thing, but it is a truth that we're actually expecting and dealing with this differently. Mass graves were common back in 1918 at the height of the pandemic. We have a few reports of mass graves around the place. They're mostly located in graveyards. We're not doing what they did, which was pick a field near the town and bury them in 1918. We're much better organised than that. Mosques in England have actually set up areas of the mosque to use as a temporary community morgue and have actually got the coffins in advance. So I think mechanically we're a lot better able to deal with high volumes of death in 2020 than we were in 1918. So not surprisingly, hospital services were impacted severely by the flu. I'm talking about direct effects of the flu, not indirect fear-based effects. What else was affected? Well, cost of wood, and most of the homes at that time were coal and wood heated, went through the roof because people didn't want to bring them into Winnipeg. And the demands for home heating had also soared because people weren't going to work, people weren't going to school, people weren't going out, so people needed to heat the house a lot more. So a lot of the people with flu in Winnipeg at this point in time, which were the majority who were poor, actually were trying to keep warm in a house with one fire in a room, or no fire for parts of the day. This was a severe issue. If Winnipeg had looked at this, they would have actually done something about this. In 2020 in Ontario, we've got a stabilisation of electrical prices. What they've done is the low peak, mid peak and high peak, they've reverted 24 hours to low peak. But I believe in England their prices of electricity have started to soar. So that's one of the other things that's going to be a problem, is that when you are consuming a lot of electricity and a lot of gas in the home, the price, if it starts to rise, is going to hurt you badly. But even if it doesn't rise, you're going to use more, so it's going to cost you more. So that's one of those indirect costs of the pandemic people haven't really understood, is the fact that although it's not going to go on for more than a few months in their minds, it's actually probably going to go on for a year or more. So the actual rise in basic prices from food and electricity and everything else is really crippling. And of course gasoline's plunged down in price, though not that much, to be honest, in percentage terms, about 35% down in percentage terms. But people don't really have much demand for gasoline to do stuff because they're not really going anywhere at the moment. And of course those of us who are using gasoline are working, so it's kind of an interesting effect about what actually is the pressures on the people locked in poor jobs without much reserves of cash. Like you get a mortgage, 6 months of mortgage, you can get that held with interest payments in Toronto right now quite easily. But if you have rent, you can't hold the rent for 6 months at all. So again, it's the more poor and the more vulnerable who are always going to be most adversely affected by any sort of bad thing that goes on in society, and a pandemic's a bad thing. But who else was affected? Strangely enough, the telephone girls, people used to make plugs in, a quarter of them got flu. That completely messed up the phone service for quite some time during the peak of the epidemic. The other areas that got hit were, not surprisingly, those that contact the public, the police, fire services, ambulances. In the modern age, until they were closed, that would be wait staff, right? Shop girls, shop boys. All of those people who interact with the public on a frequent basis, bus drivers, okay? They all got large amounts of flu, and those services were seriously impacted. One of the arguments people are using is the fact that a lot of shop people actually got sick from COVID-19 or died from it, therefore there is no airborne, therefore it is not affecting people, therefore it's all made up. Of course that's absolute nonsense, because a heck of a lot of bus drivers have got it, and a lot of them have died in the United Kingdom and elsewhere. And a lot of shop people actually have had the disease, but it's not been related to their workplace. People are thinking it's related to some contact or whatever. So I think it's kind of a misnomer to say that people aren't getting the disease dealing with the public. Pretty obviously they are. There's a lot of bus drivers got this, and you know that they're not handling the change, right? It's literally because they're this close to people. Even the National Rail Service lost about a quarter of its workers to flu at the peak of the epidemic, severely impacting the ability to move stuff across Canada. Other than for goods, trains aren't really that big a deal in our modern society in 2020. What is a big deal is truck drivers. If a significant number of truck drivers aren't able to work, we're going to be in trouble. Now obviously it's not moving a whole bunch of useless goods that we normally move around, like plastic this and plastic that, but they are moving a lot of stuff, and if we lose a quarter of the truck drivers to flu, then we are going to see a real big kicker in the supply chain. Supply chain collapse is a real thing. It only lasted a week or two and bounced back quickly. No guarantee it'll only last a week or two. Not counted in the death rate of children as the number of miscarriages. A lot of the women that had flu miscarried who were pregnant, and I think that's something that we would see. So that's also going to be an emotional as well as a physical and a cost impact on you. People who are pregnant who catch flu have got a much higher chance of miscarriage. During SARS, Toronto General and Sunnybrook treated it differently. Toronto General, any pregnant female nurse or staff member who wished to be off was allowed to go home at the beginning of the outbreak and stayed off for the entire outbreak, and I think that was good. Sunnybrook didn't do that. Each individual hospital in a public-private system like Canada and America are going to react differently. The advantages of a hospital service like the United Kingdom's National Health Service is that at least the care in each hospital will be pretty standard. Of course, I don't have any figures, but I can tell you from the big maternity part of my hospital, we are seeing a lot more miscarriages, and I have heard of people who've sadly had miscarriages. Directly related to COVID-19? Yeah. And what percentage of the rise we don't know, but like I say, Winnipeg, it was 4 times normal rate of miscarriage during this time, which is devastating. And of course, England's actually had dead nurses from COVID-19 who have then delivered babies. I think at least 1, maybe 2, and that's just horrific. And again, it's not just old people that get COVID-19. This book's a bit dry and you may not enjoy it so much, and it is also from a radical feminist Marxist perspective in places, which I have spared you. There's absolutely nothing wrong with radical Marxist feminism. It's actually kind of interesting. People tried different medications like Vicks Vapor Rub and camphor oils and eucalyptus oil. People tried pretty much anything they could find. So if you have herbal medicines that you feel might help you with a respiratory infection, I would stock up on them. The price is more than doubled, and often the supply ran out quite early on of things like that. One of the interesting things at Winnipeg at that time, it was prohibition. So there was no alcohol available. And actually the physician group said, look, we need alcohol. Alcohol's actually a good treatment for flu. Now, whether alcohol is a good treatment for flu or not is kind of irrelevant, but they recognized it as a medically recognized thing to give people who had flu. But they weren't able to give it because of prohibition. Looking at the recycling bins around my area, I've noticed a lot of people have switched to club soda and tonic water. They're probably trying to get some quinine, which is probably not in the commercial pops anyway, because based upon hydroxy, Dr. Trump's favourite medication, it doesn't work at all for COVID-19 disease. But we're also seizing on the viral medication that doesn't work for HIV, and using that as well, and doing all sorts of things. We're still looking for magic bullets. We're looking at vitamin D, we're looking at vitamin C. People are having their pet projects and taking it. I myself put myself on NAC and did a video on it. Fear is a great motivator, and having a magic protective bullet or mask is what we all want. And that's a human reaction. As long as the reaction doesn't harm other people, that was my main issue with Dr. Trump's hydroxychloroquine desire, which was terrible because it's actually vital. That medication is vital, not just for malaria, but it's also vital for lupus and a few other disorders. And to actually take that away from people that need it, to give it to people who don't need it and aren't going to help them in any way, is a terrible, terrible thing to do. So any medications that were available that had alcohol in them actually sold out quite quickly and disappeared from the shelves. As far as I know, toilet paper itself doesn't protect you from COVID-19, but I guess if you wrap enough of it around your head it would. Interestingly, for the children who survived, who had mothers die during the epidemic, they had a mortality rate 4 times higher than children whose mothers had survived. This shows how impacting social determinants of health are on your ability both to survive an epidemic and also the sequelae of it years later. There are already a fair number of COVID orphans, young children whose 1 or 2 parents have died from COVID-19 disease in the West. And it will be interesting to see, and I'm sure it will be studied, what their mortality and morbidity is like over the coming years. And it will be a sad thing that once the pandemic's over, some people will still die early from it. So Winnipeg did quarantining and masking and some degree of placarding and some degree of hospital admission, almost entirely on a voluntary basis, informing the public, asking them to do this, asking them to do that, relying on the public to comply. Voluntary works better than enforced, but we have a voluntary enforced system right now in Canada, We're almost at the $6 million mark of handing out fines to people for breaking social distancing in public places. Alberta did it a bit differently. Alberta made people go into quarantine and made them report and shut down a whole bunch of stuff. Now Winnipeg shut stuff down much longer than Alberta did. But I think this is one of the interesting things here, is that Alberta made the wearing of masks in public compulsory. The mask order, which lasted almost a month in Alberta, had no apparent effect upon the increasing number of flu cases. Public confidence in it as prevention soon gave place to ridicule. And that's true. Masks need to be N95. You need to know how to put them on and take them off and how to use them. They're not just you put it on and you're okay. I had no idea and no conception that within 2 years we'd have a pandemic and the N95s you wouldn't be able to get for love nor money as a healthcare worker in a hospital. So I hope you enjoyed that. I enjoyed reading this book, so I hope you enjoy that. I hope we never need to use this stuff, but remember, in SHTF, tomorrow will always be worse than today unless you're prepared. Toodles. Indeed, toodles. I hope you did enjoy that. Hope you did get something off it. Bit eerie in parts, where I picked up on the fact bus drivers would get whacked and stuff like that. But again, history is clear. We need to study Spanish Influenza of 1918, look at the whole of it and what happened after it. We are looking at the same scenario in 2020. It's not enough to click your heels together and hope that we're all wrong and it'll go away and you can get back to your normal life. Normal life for the duration is ended for everybody, and it won't be coming back the same way that it left. This is definitively marking our generation and changing how we were going into a different way. Hopefully a better way, though I have my doubts because I'm a cynic. Toodles. This was a Wonderful Cat production, 2020.